Today we're counting down my top 5 favorite over-the-counter acne ingredients. With acne being such a common skin disorder, you want to stick around and see all of my top recommendations so you can manage acne, hopefully with just over-the-counter ingredients. Hey guys, welcome back to the channel. Today we are covering acne. Again, it is one of the most common skin disorders, and over 80% of people will experience acne at some point in their life. Of course, it's most common in adolescence, but it seems that more and more adults are dealing with persistent acne, whether it's hormonal or just typical all over the face acne. I don't know if it's something in our diets that we're eating, but there's a lot of reasons possibly why we're seeing more and more adult acne. That being said, it's still most common in teenagers and adolescents. So we're going to be talking about my favorite ways to treat acne using just over-the-counter ingredients. Of course, dermatologists have a lot of great options when it comes to treating acne, but most of the time you're going to start with over-the-counter solutions, and if those don't work, that's the appropriate time to go and see a dermatologist. So if you're going to be picking over-the-counter ingredients, you need to know what things actually work and what things don't. So we're going to be covering from my least favorite to my most favorite, or maybe the least potent to the most potent, in my opinion, the best things you can pick over the counter to treat your acne. Now we know that these ingredients work because they've been studied, and some of them used to be prescription only, and now they are available over the counter. Additionally, when we look at any of the readily available acne systems available over the counter, I'm talking about things like Proactive and other competitors, they use most of these ingredients because they are tried and tested, and we know that they work for a lot of people. So without delaying any longer, let's jump into it. Starting with number 5 is niacinamide. Niacinamide is in so many over-the-counter skincare preparations nowadays because it's a really well-tolerated ingredient and it does a lot of good stuff. We know that niacinamide can help to control inflammation, and that inflammatory response to acne-causing bacteria is part of what leads to inflammatory acne. So if we can control the inflammation from the comedones, from the blackheads, the whiteheads, then we may not have as severe of acne, and that inflammation is what can lead to scarring. Niacinamide has also been shown to help decrease oil production, or to help regulate oil production. And if you have very oily skin and you're acne prone, you might have some benefit from cutting back on the oil production just a little bit. Now, niacinamide, in my opinion, is not the most potent acne fighting ingredient, and it barely made the list when we're talking things that will treat acne. But I do think that there's some benefit to it in treating acne, so I wanted to include it on the list. But you'll see that niacinamide is in many over-the-counter preparations, whether it's for pigmentation, whether it's for acne, whether it's for anti-aging, because it is a really well-tolerated and universally applicable type of ingredient. It does a lot of good stuff. So I wouldn't go out of your way to get niacinamide just as a way to treat your acne, but if you're treating your acne with some of these other methods, you might find additional benefit by adding niacinamide into your skincare routine. Number 4 is azelaic acid. Azelaic acid is a dicarboxylic acid, so this is something that helps to kill acne-causing bacteria. Azelaic acid can be used in acne, it can be used in rosacea, it may have a role in other skin diseases as well. It can be a brightening agent if you have post-breakout dark marks. So again, kind of like niacinamide, azelaic acid has wide applicability for a number of different skin conditions. Now, because azelaic acid can be irritating, I don't think you should jump into a really high percentage of this right from the get-go. We do have azelaic acid available by prescription. If it's 15% or higher, you have to have a prescription to obtain niacinamide. But if it's lower than 15%, that can be obtained over the counter. Of course, there's a lot of over-the-counter preparations, again, that have azelaic acid in it for things like acne or pigmentation or other skin concerns. In addition to the Inky list, The Ordinary also has an azelaic acid preparation. So those are just a couple of options available to you. Another one that I like is from Foundation Skincare, and I'll try to leave links to these products in the video description. I personally find that azelaic acid just stings my skin a little bit. I always have to follow it up with a moisturizer, so be aware of that. If you do get a little bit of irritation from it, you may need to follow it up with a moisturizer. However, I think that there is some help from azelaic acid, so if you've tried some of the things that are going to be coming later on this list and they haven't worked well for you, consider trying azelaic acid. But if you're new to treating acne with over-the-counter regimens, I think you're going to want to wait for one of the next 3 active ingredients in order to tackle your acne. Number 3 is salicylic acid. Salicylic acid is one of those ingredients that can help to actually get through the oil on your skin because it is a beta hydroxy acid. So again, if you're very oily and acne prone, a salicylic acid type product may be really beneficial for you. Salicylic acid is present in lots of different types of products. Of course, it's in many different cleansers, and the cleansers are great because you're not getting a long contact time. Because salicylic acid also has the ability to be irritating, sometimes you may not be able to tolerate a leave-on preparation. So you're going to get a wash with something like 0.5% salicylic acid, and you can lather that on the face, let it sit for a few minutes, and then rinse it off. And it'll help to decrease oil that is present on your skin, and it will help to kind of regulate the oil production and the acne-causing bacteria. Now, if you don't get a lot of irritation from salicylic acid, there's a number of sal acid preparations that are leave-on. So these are going to be serums usually that you can topically apply, and I do find them pretty helpful for hormonal type acne. So if you get that deep cystic type acne along the jawline, spot treating that with a potent salicylic acid can sometimes help to get those cystic type lesions to go away a little bit earlier than they might otherwise. Because it is a beta hydroxy acid, we get a little bit of exfoliation from it, so it does help to increase the loss of those dead skin cells off the top and help to give you a more radiant complexion, and that in and of itself can help lead to the improvement of acne. Just be careful not to start all these different products at one time because each acne product, as we've talked about, does have the potential to lead to dryness. So you don't want to start using salicylic acid and azelaic acid and one of the other products that we're going to talk about here shortly, because it could lead to a lot of dryness, and then you don't know, is it all the products combined or is it one product versus the other that my skin isn't tolerating? So it's always a good idea to pick a product and ease into it, stick with that for 4 to 6 weeks before you consider adding another product. Number 2 on the list is benzoyl peroxide. Benzoyl peroxide has been around forever and it remains a really good way to treat acne. Benzoyl peroxide is an antibiotic essentially. It is something that helps to kill acne-causing bacteria. One of the great benefits of benzoyl peroxide is that the bacteria that lead to acne have not developed antibiotic resistance to benzoyl peroxide. So that's why it's remained one of the best over-the-counter ingredients that you can get for your acne, and it's even included in many topical preparations that we give by prescription at the dermatologist office. One of the most common antibiotics that we'll use to treat acne topically is called clindamycin. So you can only get that by prescription. Part of the problem is that the bacteria that cause acne often become resistant to clindamycin very easy. So when we combine a clindamycin topically with a benzoyl peroxide, we essentially negate that risk of antibiotic resistance, and the benzoyl peroxide and clindamycin, when given in combination, work better than either one alone. Now, just like salicylic acid, benzoyl peroxide has the ability to cause dryness and irritation. Acne is often associated with more oily skin, but it can happen with dry skin too. So especially if you have dry or sensitive skin, you have to be cautious about how much of these products that you're using. Benzoyl peroxide can be used in a wash or a cleanser, and in that case, again, you're getting that short contact time to help kill bacteria, but you're not leaving it on the skin, meaning there's less risk of persistent irritation. However, it's great for spot treatment as well. If you get inflammatory acne, putting a small amount of benzoyl peroxide right on top of those inflammatory acne lesions is a great way to help get them to resolve a little bit faster. One more warning about benzoyl peroxide is that because it's a peroxide, it can bleach fabric. So you may have noticed that by using certain over-the-counter acne products is that your towels start to turn orange or white, or that you have dark colored clothing and that starts to turn a color if it's getting exposed to the benzoyl peroxide. So if you're using it topically or in a wash, if it's in a wash, you want to make sure it's rinsed off really well before you towel off, and make sure you're using old towels or white towels so you're not going to notice any bleaching effect. Or if you're using it in a topical leave-on preparation, if you're using it in the morning, get dressed first so you're not putting it on your skin and then pulling a shirt or a sweatshirt over the top. If you're using it at nighttime, just be aware that you should wear an old t-shirt or have an old pillowcase, because all of those things have the potential to start to change color as a result of the benzoyl peroxide. And last but not least, my number one favorite over-the-counter acne treatment ingredient is adapalene. Retinols have been a mainstay of acne treatment in the dermatology office for decades. The most commonly prescribed is called tretinoin, and that is a retinoid medication that's applied topically to the skin. It worked so well that companies started to try to reinvent the wheel, so to speak, and change the retinoid molecule to try to get better penetration or a better effect. And we've had some other really great synthetic retinoids developed, and adapalene is one of those. For a long time, adapalene was available only by prescription. But a few years ago, 0.1% adapalene went over the counter. So you can pick this up. The brand name is Differin. There's also one by La Roche-Posay. And these are both relatively inexpensive. You're going to be spending anywhere between $15 to $22 approximately in order to pick these up in most areas of the United States. A retinoid is not necessarily a great spot treatment. So if you have existing acne, putting on a retinoid is not going to do a whole lot to make that bump go away faster. However, a retinoid can be a great way to help prevent new acne bumps from coming up. What I recommend to my patients is when using a retinoid is to take a pea-sized amount on the tip of your finger, dot your forehead, chin, cheeks, and nose, and rub that in. Don't get too close to your eyes or your mouth because those areas tend to get a little bit more sensitive. You should always apply your retinoid on dry skin. So if you've washed your face at nighttime, make sure you pat it dry and that the skin is dry before you apply that retinoid medication, before you apply the adapalene. And then once you've applied it, it's totally okay to add a moisturizer afterwards. That can help to mitigate the risk of additional irritation. I do always recommend using a retinoid at night and then using something like benzoyl peroxide in the morning. Fortunately, benzoyl peroxide does not interact with adapalene, but if you have prescription tretinoin, you cannot use that with benzoyl peroxide. Just something to be aware of. A couple of warnings when using adapalene. Again, it is an acne medication and it has the potential to cause dryness. Overall, from the retinoid family, adapalene is a bit more mild, so the risk of irritation is lower than with some of the other prescription retinoids. However, it's still present and some people just cannot tolerate a prescription or non-prescription retinoid. In that case, you might be able to tolerate a retinol, which is not quite as potent, and I'll have some of those linked in the video description. Or you may need to use something like bakuchiol. Bakuchiol is a botanical or plant derivative that functions kind of similar like a retinoid, but it doesn't work exactly the same inside the skin, but it helps to turn over the skin cells and give you some of that benefit, but it hasn't been studied specifically for the treatment or prevention of acne. Remember that when using adapalene, you do want to be careful about sun exposure. Retinoids do have the ability to slightly increase your risk of sunburn. I think overall it's a pretty mild effect, but as a dermatologist, I want you to protect your skin all the time anyway. In addition to being great for the prevention of acne, all retinoids have some anti-aging potential, and I get asked all the time, is it okay to start a retinoid if I'm 22 or if I'm 17 or whatever it is? Essentially, we prescribe retinoids in the clinic to kids, as young as 11, 12, 13 years old. Sometimes younger for infantile acne. We might even use a topical retinoid. So there's really not an age limit where it'd be inappropriate to use it for anti-aging purposes, as long as it doesn't cause dryness and irritation on your skin. So there you have it. Those are my 5 favorite over-the-counter acne fighting ingredients. Let me know if you guys have used any of those or if you're gonna incorporate one of them into your skincare routine now. Remember, always have a good gentle cleanser in your acne routine. If you haven't developed a good skincare routine for treating acne, you can check out some of my other videos for that purpose. And always have a good moisturizer because all of those acne medications have the ability to cause some irritation. So you don't want to end up with dry, flaky skin while you're trying to treat or prevent acne. If you're looking for new skincare ingredients, including some of these like salicylic acid or benzoyl peroxide, you can always check out 208SkinDoc.com, 208SKN.com. Those are the products that I recommend in my clinic every day to my own patients. So if you need a benzoyl peroxide cleanser or a glycolic salicylic acid cleanser or even an over-the-counter type retinol, you can pick those up from that website shipped directly to your house. And that's one way that you can support the channel, and I appreciate your support so I can keep doing this and providing education to you. Let me know if you guys have other questions or topics you want me to tackle. Hopefully this was a good, informative video for you, and I'll look forward to seeing you guys back next time.